Hello, friends. Shall we start? Am I audible to you? Am I audible to you? Please let me know if I'm audible to you. Good evening, people. Good evening. Yes, good evening, Saramsh. Good evening, Scorpion. Good evening, Raj Bharat. Vashni Granger. Yes. Yes, come on. Okay, we are waiting for the people to join us. Give us some 30 seconds. Okay, so as well as the joining, let me finish the mandatory protocol that is to be done for every special class. This is my introduction. I've been a quiz master. I've been teaching MBBS and MD students for the last 11 years. And you have something called as Plus subscription on Academy. And if you subscribe to Plus classes, you will be open for unlimited access to ultimate classes in an academy. For every subject, you can have more than 2 faculty, and you will be having approximately 60 to 70 faculty teaching you. Multiple classes will be going on. Though there is some kind of clutter, you will be knowing you will never run out of teaching subjects. And let me put my face to the other side. And I am teaching right now in 2 different batches. That is, there is a target 2021 batch and there's a target 2022 batch. In both the batches, I'm teaching in the month of October, November, and December. I'll be teaching microbiology test and discussion series, and I'll be doing biochemistry complete A to Z courses. So if you would like to subscribe to an academy, you can use the code Dr. ASMYT. Not just one faculty, for every subject you can have more than 2 faculties. And there is an iconic subscription as a combination of both live classes of an academy and free, recorded sessions of Prep Ladder. And with this, we are concluding the free live classes for this month. This is the last free class from me for the month of November, but I will not let you alone on microbiology and biochemistry preparation. As some students have requested, we will be having an Academy app-based MCQs, an Academy app-based quizzes. Will you be liking it? Hello, people. There is a quizzing provision in an Academy app. So tomorrow, day after tomorrow, and the last day, for the next 3 days, we'll do an Academy app-based quiz contest. We'll do quizzes, daily 4 to 5 quizzes, each quiz lodging for approximately 5 to 10 minutes. We'll finish in half an hour. We'll be finishing approximately 30, 40 MCQs, okay, every day. So shall we start? And if you would like to know the updates, you can join me on an Academy here, or for all the voice is not clear, Preeti Pandey. Others, are you able to hear me properly? Okay, Preeti Pandey, for your sake, I'll refresh once. Just check out whether you'll be able to hear it properly. Okay, Preeti Pandey, are you able to see now? Are my words clear, Preeti Pandey? Preeti Pandey, I'm talking to you. Please say yes or no. I'm waiting for your answer. No, not others. I'm just asking only one person. Preeti Pandey, are you able to hear clearly? Yes, for subscribers will be continued. Wait a minute. Preeti Pandey, are you able to hear me? Thank you very much, Scorpion. Thank you, Professor. Thank you, Proud Indian. Thank you so much. So shall we start, people? If I'm clear, shall we start? Okay, so let's go for the first question. Which of the following least predisposes to infective endocarditis? Now, let us not go for the poll to begin with. This can be a wild-being question. Give me an answer on the comment box section. Which do you think is the right answer here? Yes. What do you think is the reason? Okay, now I have seen equal number of people choosing A, B, and C also. There is one person who has chosen, okay, there are two people who have chosen D also. So all the answers have been chosen. Which of the following least predisposes to infective endocarditis is the question. What is the purpose of having the concept of infective endocarditis? Okay, so in case of tetralogy of Fallot, you have four different logic. Can you tell me what is that logic which can cause constriction of flow of blood? We have four things in tetralogy of Fallot. Among the four, which one causes constriction of the flow of blood? Excellent. You can have pulmonary stenosis. But because the stenosis is pulmonary, this will not be reflecting on the heart, because of which tetralogy of Fallot will be having lesser chances of infective endocarditis. But when there is a septal defect, be it ventricular or atrial, please remember, in these areas, in those areas where the blood is about to pass, the organisms can start littering around the area, because of which accumulation of masses can happen. So vegetations can become very common. Now, the next best answer for this would be atrial septal defect. In patent ductus arteriosus, you'll be having bidirectional flow of blood, because of which again you can expect the flow of blood to bring back vegetations, because of which you can have infections. Now, let's start with the question. A patient who's allergic to penicillin can be prescribed which of the following drugs for prophylaxis of acute rheumatic fever? A patient who is allergic to penicillin can be prescribed which of the following drugs for the prophylaxis of acute rheumatic fever? Prophylaxis. Use the poll, people. Yes, they can have TOF greater than ASD. That is the right answer, Balamurugan. Okay, Tintin is on top, Saransh Agarwal second, Raj is third, Priyanka fourth, Balamurugan fifth, Hariprasad sixth, Prajwalit Banu seventh, Radhika Chandra eighth, Sheikh ninth, and Shweta 10th. Okay, now let's look at this. You cannot actually go for cotrimoxazole or tetracycline, and definitely not ciprofloxacin, because when you have rheumatic fever, it is actually the rheumatological disease. And when there is a rheumatological disease, when you give ciprofloxacin, it can cause cartilaginous injury. So at no point of time I will be comfortable to choose a fluoroquinolone as a prophylactic agent. The best answer here for prophylaxis can be erythromycin. Let's go for the next question. Following drugs are used for H. pylori eradication, except which one? Following drugs are used for H. pylori eradication, except. Now this question requires some thought process. When you saw the answer, you might be shocked, but do not be shocked. You need to use the thought process and the concepts to give the answer. Okay, we have 4 seconds. Let me tell you. There is something called as colloidal bismuth subcitrate. CBS is not known for eradicating H. pylori because it is not an antibacterial agent. Please understand, you will be having colloidal bismuth subcitrate being actually treating for the substance area. In the mucosa, you want some kind of protection to the mucosa so that when HCl attacks this area, HCl can be repelled. So bismuth is capable of helping you shield the area, not for eradicating H. pylori. And H. pylori eradication will need either a particular drug which can destroy the chances of the organism to grow or can destroy the organism itself. Amoxicillin, tetracycline, cephalexin are all capable of being antibacterials who can have effect on H. pylori. But other kind of drugs can create anaerobicity because of which the organism can be blocked. Next question. A 15-year-old boy is brought to the emergency with 2 days of history of headache, vomiting, altered sensorium, BP 70 millimeters of mercury systolic, and he has ecchymosis on his skin. The most likely organism causing his condition is what? I hope 100% of you can give me the right answer here. See, when the question is mildly annoying or the question is beautiful, both the credits and the bad thing does not go to me. I am actually reproducing the past questions. In this session, I am not using just FMGE questions. I'm using NEET exam questions. I'm using AIIMS exam questions and JIPMET exam questions. Some questions can slightly annoy you, but ask yourself one thing. In the practice session itself, if you're getting annoyed with some questions, imagine such a question comes to you in your exam. How would you feel? So it is better to face these kind of questions in classrooms and get a solution, or even if I don't give a solution, at least you have the chance to get a solution outside after this class, rather than going to the exam and feeling the question for the first time. Is it not? Am I correct or not? The right answer here is meningococcus. Can you people tell me at which point of time this is meningococcus? In this question paper, what are the pointers towards meningococcus? Come on, people. See, ecchymosis can be common. Please remember, ecchymosis cannot be a 100% diagnostic feature. A 15-year-old boy says he is adolescent. Yesterday, I told you the most common cause of meningitis in adolescent age group is meningococcus. Also remember, BP 70 millimeters of mercury systolic. What does it indicate? The patient is right now suffering from what? When the BP is less than 80 or less than 100, what do you think right now the patient is suffering from? Excellent. So he's suffering from sepsis or septicemia. What is the condition called as? Anybody? It's called as Waterhouse-Friderichsen syndrome. Excellent, Hariprasad. So right now the patient is having Waterhouse-Friderichsen syndrome because of meningococcus. Welcome, Sai Bardwaj and Hridya Tyagi. Next question. A child presents with episode of hematuria soon after respiratory tract infection. What is the most likely diagnosis? Now, some people may make mistakes in this question. So if I give you the explanation, then you'll actually be like, oh my God, we missed it. That is what is the problem here. But it's better to make these mistakes in the exams itself. Remember one thing, whenever you have a respiratory tract infection, unless otherwise you prove it is sore throat, you can't commit Streptococcus pyogenes to it. Yes or no? Let me ask you simple questions for your answer. Tell me, when I have respiratory infection, it can be anything. So when I speak about respiratory infections, sore throat, if at all I speak about sore throat, only then I'll be able to commit Streptococcus pyogenes towards the site. And this will be latent antigen floating in the body against which antibodies are getting generated. So you will need time for the post-streptococcal glomerular. Professor, am I not audible to you? Am I audible to you? Yes or no, people? Can you please tell me faster? No voice? Okay, sometimes the network can be slightly breaking. I'll refresh it one last time. Is it fine? Shall I refresh the page one last time? I'm taking your permission. Please let me know. Okay. Yes. Can you hear me now properly? Am I audible to you now properly? Please tell me if I'm not audible, okay? Yes. Now, please understand, whenever you have PSGN, post-streptococcal glomerulonephritis, it is because the antibodies have been triggered against the antigen, even though the organism has left the body. So after complete cure of sore throat, you can hit this drug. What am I saying? The child is present with episode of hematuria soon after respiratory infection. So it is a very short incubation period. I have to go for IgA nephropathy and not anything else. Let's go to the next question. A known case of lepromatous leprosy was initiated on treatment. Should have painful erythematous papules with fever and lymphadenopathy. What is the likely reactivational state? Simple question. Don't make a mistake in this. A very simple question. Do not make a mistake in this. This is a simple question, but I picked this question for only one reason. I wanted you to go back and revise two important concepts. One is Lucio phenomenon. The other is lupus pernio. Please take this as a homework for your central exams. That is, you will be getting, I just now came to know that on November 20th, you have INI CET. How many of you here are taking this exam, people? How many of you here are going to take this exam? Can you please put a Y if you're going to take the exam? Hari Prasad is on top, HD second, Raji third, Tintin fourth, Palamurugan fifth, Priyanka sixth, Abhi seventh, Raj eighth, Professor ninth, and Scorpion 10th. Okay, very well played. All the best people who are going to write the exam. Remember, this erythematous papules with fever is the description for a disease called as, condition called as erythema nodosum leprosum. And erythema nodosum leprosum is definitely type 2 lepra reaction. Lucio phenomenon is worsening of the CMI. The patient initially can be divided into tuberculous leprosy, borderline tuberculous, borderline lepromatous, and lepromatous leprosy. In that, when he is moving from a very good CMI towards a very bad CMI called as LL, even then you have not started any treatment, the patient becomes even worse. That condition is called as Lucio phenomenon. So the organism actually goes for a multibacillary state. It starts penetrating into every part of your body. Lucio phenomenon can be fatal because the organism can become septic in nature. Though it does not actually produce any toxin, it can become a part of your blood. Bacteremia can be seen. Different focus of the organism can be seen. Now take this as homework and find out what is lupus pernio. Okay. Next question. Multi-drug resistant tuberculosis is defined as, MDR is defined as what? Okay, poll is not working. Can you give me an answer in the comment box section, please? Yes. Okay, I think the poll is working now. Come on, people. Yes, use the poll. Use the poll now. Anmol Das is the fastest for this question. Very well played, Anmol Das. Are you new to this class, Anmol Das? Have you come to this class for the first time? Remember, you have something called as XDR-TB. In that, you will be having INH, rifampicin. Yes, very good. Thank you very much, Anmol Das, for coming to the class. Come for the next month also. INH, rifampicin, ethambutol, pyrazinamide. All class 1 drugs have become resistant. Then you call it as XDR-TB. But in case of MDR-TB, at least inosinazid and rifampicin, the two major drugs should be showing resistance, and two class 2 agents, two of the class 2 agents should be resistant. Okay, let's go to the next question. The drug of choice in the treatment of esophageal candidiasis right now is which one? Right now, what is the treatment of choice? Okay, so this is a combination of microbiology plus pharmacological logic. So remember one thing, people, nystatin oral suspension has been chosen by many people. Nystatin can be used only as a swish spit preparation. If you have not heard of this before, please hear it now. Nystatin is generally used as a swish spit preparation. Swish spit means what? I take drops of nystatin and I coat the upper part of my tongue. Then I make my tongue move forward and backward to touch the lower part of the palate. When it happens, I spit it off because the drug is not supposed to overflow into the gums. The drug is not supposed to enter into your teeth areas or sockets. So remember, that is called as swish spit preparation. Rarely you can go for oral suspension, but this is a case of esophageal candidiasis. Tell me, is it easy to treat or difficult to treat? Esophageal candidiasis is easy or difficult to treat? Welcome, Tenzin. Welcome, Dr. Sharif Ahmed. Tell me, people, esophageal candidiasis or candidal esophagitis, is it easy or difficult? Remember, it is difficult to treat. You know why? Because esophageal candidiasis can tell you only one thing: the patient is suffering from severe immunosuppression, or he can have global immunosuppression called as AIDS. Okay, Anmol, IV amphotericin cannot be given for a very long time period. Candidiasis, do you think it is going to be for a very short period or for a very long period? You tell me, people. Candidiasis is there to stay for a long period or a short period? For a long period. So if at all you're suffering from AIDS, every single day your life is a battle. And every day you have to remove the Candida from your circulation. But you know, in your oral cavity, in the fecal material, in your urine, you can expect Candida. So Candida is not a foreign organism, it's a commensal. And when you're suffering from immunosuppression, every day you have to battle Candida. So you can't keep on trusting amphotericin B, because amphotericin B is used only as a last ditch stand. It means when nothing is working, go for amphotericin B, because amphotericin B by itself can kill your kidney and fry your kidneys and cause hypokalemia. So because of the toxicity of amphotericin B, I choose it only for life-threatening situations, but not for regular esophageal candidiasis. Is that clear, people? Did you understand, Anmol? Yes. Killer T cells, which are responsible for defense against intracellular pathogen, are expressed by which are the following CD phenotypes? Okay, Anmol, you're saying it is drug of choice in rhinocerebral mucormycosis. Remember, mucor is a different organism. Candida is a yeast-like fungus. Candida is a yeast-like fungus, while mucor is a very low-class mold. And your information is almost 7 years old and outdated. Why? Because only till the last 7 years, amphotericin was even tried. Now people are not even trying amphotericin B. For mucormycosis, the drug of choice 6 years back was posaconazole. Now the current drug of choice is isavuconazole. Do you get my point, Anmol? Isavuconazole is the drug of choice. Amphotericin B is done away with. Are you following this, Anmol? Yes or no? Okay, the right answer is CD8. Please remember, it's a very simple question, dead easy question. You think about two types of T cells. T cells are divided into T helper cell and T cytotoxic cells. T helper are called as CD4 because they exhibit CD4 receptors. T8 cells are the ones who are divided into cytotoxic and suppressor. Now, CD4 is divided into effector and regulator. So totally we have 4 types of T cells: T helper, effector, T helper, regulator, T8 cytotoxic, T8 suppressor. Let's go for the next question. Consider the following. Okay, let's not do this. It will be taking time because that is general medicine mostly. Look at this. A middle-aged male, known smoker, presented with recurrent sinusitis, hemoptysis, hematuria, arthralgia, palpable purpura. What is the most likely diagnosis? Tintin, Raji Chandu, Sai Bardwaj have given the fastest answers. HD and Dr. Abhi have followed with the right answers. The most important keyword is smoker. Like how smoking and TB are related, they can cause multiplicative action. Here, the smoking and the granulomatous disease can have a multiplicative action. Look at this. Here, please remember, whenever we speak about kidney being involved plus lung being involved, there are 2 conditions you have to take into equation. One is Wegener's, the other one is Goodpasture syndrome. But Goodpasture syndrome is an example for a hypersensitive reaction. Can anybody tell me which type of hypersensitivity is Goodpasture? Can you tell me which type? Please don't make the mistake again. It is not type 3, it is type 2. Goodpasture syndrome is type 2. This is not a case of type 2 hypersensitive reaction. This is a case of recurrent sinusitis, hemoptysis, hematuria, arthralgia, palpable purpura. It indicates different zones where the granulomas are getting settled. When the granulomas are settling, the granulomas are not allowing the proper outflow of sinus fluid. When sinus fluid accumulates, that is in the orifice where the sinus fluid is draining, when the granulomas are blocking, sinus fluid can't come outside, because of which you'll have recurrent sinusitis. Similarly, in every single area, they're capable of accumulating. The granuloma space occupying lesion is the reason behind all the scenarios. Let's go for the next question. A patient presents with diarrhea, steatorrhea, weight loss. Which of the following diseases least possible? Excellent. Can you tell me what is the meaning of your answer? Let us not reveal the answer. Tell me what is the meaning of the answer? What disease is it? It attacks what? Anybody? Excellent. So here you're focusing on diarrhea, steatorrhea, and weight loss. Diarrhea, steatorrhea, weight loss can be a property of Whipple's tropical spoon celiac disease, but Menetrier's disease is known only for extra abnormal above self-folding of the mucosa. That does not mean the patient will have diarrhea. Okay, next question. Consider the following statements about post-streptococcal glomerulonephritis. Immunosuppressive therapy is effective. PSGN develops 1 to 3 weeks after streptococcal pharyngitis. PSGN develops 2 to 6 weeks after impetigo. The classical presentation is acute nephritis. Among the following, which one is correct? You just choose the answer in the comment box section, people. Use the comment box section to give me an answer. Okay. Remember, whenever it is PSGN, if you go for immunosuppressive therapy is capable of suppressing only the T4 and T8 lymphocytes. They will not suppress the already exhibiting antibodies. And the antibodies who have deposited in the local area and causing antigen-antibody complement complex will not be brought down because of immunosuppression. So any option who contains one should be knocked out of the equation. So what is the best answer you think? Hello? Yes. So PSGN happens fastest following what? From this question, you understand one thing. PSGN happens fastest after what? Because primary infection of streptococcus can attack either the skin or the mucosa. So you tell me, attack on what will resign the PSGN fastest? Excellent, pharynx. So PSGN develops 1 to 3 weeks after pharyngitis and 2 to 6 weeks after impetigo is what I want you to understand. So I repeat once again, if it is a skin infection, the ability of the antigens to be understood by your immune system takes time. I repeat, if it is PSGN following pharyngitis, the ability of your body to understand the antigens will take a lot of time. So in case of pharyngitis, you will not have much amount of time. For skin infections, it will take a lot of time for the antigens to be penetrating through your body to enter into circulation. But for pharynx, the mucosal antigens can reach faster. That's all. Let's go for the next question. A patient of AIDS developed ophthalmoplegia, ataxia, global confusion. He is likely to have the deficiency of what? Now, I know you all can get the answer perfectly correct. But now I want to see, when you choose the answer, how will you link that answer with AIDS? How will you link that answer with AIDS? I have taught this on various occasions. I told you the mnemonic also, GOA MP. GOA is global aphasia, O ophthalmoplegia, A ataxia, N is mental illness or mental retardation or mental memory loss, P is peripheral neuropathy. So all these are features of what I have told you. All these are features of what? Whatever I told you are all features of what? They can be a combination of Wernicke-Korsakoff psychosis along with that of beriberi. It means involved activity is thiamine. You all can answer this very well, but you tell me now how thiamine is related to AIDS. How thiamine is related to AIDS. In AIDS, are you sure you'll be having malnutrition? In AIDS, you have catabolism. In AIDS, you'll be having cachexia. I understand. Loss of body weight can be seen. Okay, immunosuppression is what we understand about AIDS, but what is the relationship with thiamine? Please remember, in case of AIDS, the ability of your body to convert thiamine into active form of thiamine pyrophosphate fails because the kinase enzymes, which are resulting important for conversion of thiamine into phosphate and thiamine pyrophosphate becomes deficient. Also remember, in AIDS patients, there can be malabsorption. Malabsorption. In spite of eating properly, they will not be able to have enough amount of nutrition. Are you okay with this information, people? Okay, now look at this. A chemical factory worker has acute onset dyspnea with fever, chills, malaise following a few hours of exposure to a new chemical. These symptoms resolve in 4 to 5 days after removal from the exposure. He is likely to have what? The poll is not working. Can you please give the answer in the comment box section, please? Excellent. So remember, whenever, say, for example, when your mom shouts at you and says that she's having some burning sensation in your fingers, what is your primary diagnosis? When your mom is a housewife and she's working every day and she's showing you all signs and symptoms of burning sensation after coming back from washing clothes or washing utensils, what do you think? Excellent intent. So you ask for one question whether it is a new detergent or a new soap, and then you make a diagnosis of contact dermatitis. So you can't just say allergic, you have to be even more specific. It is contact dermatitis, and that would mean to say here you're having hypersensitive pneumonitis. It is not cryptogenic and it is not atypical pneumonia. Atypical pneumonia will be caused by atypical microbes. Non-specific interstitial pneumonia, not correct, because you have to have some kind of stimulus. Here the stimulus is a hypersensitive reaction causing pneumonitis. It is not pneumonia, it is pneumonitis. And this is not going to resolve. This is not going to form consolidation. It will resolve on its own. Next question. 24-year-old man presents with nausea, vomiting, and diarrhea with crampy abdominal pain. He gives history of consumption of rice preparation in his last meal. What is the likely organism causing above complaints? Now, some of you will be confused. I know very sure that all of you will be confused. Do you know where exactly you fell for the question? You did not check for the word fried. Yes or no? You did not check for the word fried. You did not check for the word Chinese food. You did not check for the word vanilla sauce. These are the ones you have to know. Yes, we have not, even though they are not giving you the duration at all, still you have to think about one thing. The crampy abdominal pain is always a property of Staphylococcus aureus. Please understand, crampy abdominal pain is always a property of Staphylococcus aureus. Say, for example, you take into consideration the 6 hours duration. 1 to 6 hours duration. Do you know which food poisonings will have 1 to 6 hour duration? Number 1, Staph aureus enterotoxin. Number 2, yes, Anmoldas, that is what I'm saying. Number 1, Staph aureus. Number 2, in case of Bacillus cereus, you have the emetic form and the diarrheal form. The emetic form will happen within 1 to 6 hours. Diarrheal form can take more than 6 hours. Then we have E. coli. The heat stable toxin of E. coli will take 1 to 6 hours. Heat labile will take 8 to 16 hours. So within 1 to 6 hours, we have a lot of variations and chances. You can't take your chances. Please understand, focus on crampy abdominal pain. Why is there a cramp? Because Staphylococcus aureus can directly activate the vagus and parasympathetic nerves of GIT, and their function is to cause increased contraction, increased peristalsis of the GIT. More the peristalsis, you will be having more spasmodic abdominal pain. That is the reason. Okay. Next question. A 5-year-old child is brought to you with history of fever for 7 days associated with rash, anorexia, myalgia, petechial hemorrhage. Which of the following investigations will be the most appropriate for making a diagnosis of dengue fever? Most appropriate is the question. Yes. Now some people might be slightly annoyed because they think one particular answer is absolutely beautiful. Then why are you not choosing it? Let's finish it and let you know. Okay, this is the leaderboard. Hari Prasad is on top, Raji Chandu, Raj, Tintin, Varshini, HD, Priyanka, Dr. Abhi, Sai Bardwaj, Popcorn. Now let me ask you a question. Do you have anything to ask me? Because from November 1st, I'll be going for COVID duty. I will not be available to take free classes between November 1 to 14. I'll come back on 14th or 15th for your classes and go for immediate revision courses. That is all MCQ classes, free classes for MCQs. Before that, do you have anything to ask me? Is there any way by which I can help you? Anmoldas, yes, I'm taking plus classes. Did you not come to the beginning of the session? Did you join in the middle? Anmoldas, I said, for 2021 batch course, I'm doing test and discussion for microbiology. 2022 batch, I am doing complete course of A to Z. There is a course called as comprehensive course of biochemistry. Do some pharmacology questions during November. Okay. High yields for INI. Okay. So between 14 to 20th of November, I'll do INI CET based questions. All the past questions from AIMS, PG Chandigarh, JIPMER, and FMC Pune. Is that okay for you people? Would you like it? Okay, the right answer here is detection of NS1 antigen. Please understand, the antibodies in case of dengue are non-specific. The antibodies in dengue or dengue are not enough to make a diagnosis. They can give you an idea that the diagnosis can be done. But what is the beauty of dengue? Dengue has one important problem. That problem is that these antibodies are non-neutralizing antibodies. You know this, yes or no? If you know it, I'll leave it. If you do not know, I'll explain it to you. Please tell me faster. Okay, let me tell you this. Listen very carefully. See, anytime when a particular virus or a bacteria enters into your body, the purpose of production of IgM antibody is to go back and block their toxins. If they can't block the toxins, either they block the organism itself by knocking on some antigen. So the antibody's primary purpose is to go back and block the antibody so that both can be easily phagocytosed and thrown out of the body. But you have to understand, when you suffer from dengue, the IgM antibodies of dengue will not be able to make proper contact with the antigen, so that they will be surrounding the antigen, but they'll not be neutralizing the antigen. It means the antigen will be still in complete force. Now what happens the second time, if you're getting infected by the second strain of dengue or the same strain of dengue for the next time, again these antibodies will be produced, but these antibodies will react and they'll communicate with the other antibodies so that these antibodies will act as a shield against the antigen. So these antibodies also will fail against this antigen, and these antibodies will trigger immune responses. Are you following this part? So it becomes worse. In all the other condition, the second antibody will try to trigger the first antibody to knock off the organism faster. But in this situation, the second antibody is failing because the first antibody is making sure the second antibody does not reach. Also, the second antibody and the first antibody together will destroy the destroy the immune system. They'll trigger the immune system to destroy yourself. So it becomes worse. Are you following this part? Hello? Yes. Let's go for the next question. An 8-year-old boy was diagnosed to have P. vivax malaria and was treated with appropriate dosages of chloroquine. The fever subsided but recurred after 3 weeks. Peripheral smear was again positive for vivax. The child should now be treated as a case with what? Use the comment box section and tell me the answer, please. Use the comment box section. So all of you are very good. The right answer is relapse. It can't be recrudescence. It can't be either relapse or recrudescence. Why? What is relapse? What is relapse? Yes, you think of hypnozoids. Just because you say hypnozoids, it does not mean always there is relapse or recrudescence. Watch very carefully. The fever subsided but recurred after 3 weeks. When there was a treatment, the fever subsided. After that 3 weeks, it has come back. Here, it can't be recrudescence because recrudescence will not happen so faster. It is relapse because the treatment was not successful. Can you tell me why the treatment was not successful? See, the treatment was only substantial, but not successful. Why not? No, you're not saying there's a drug resistance. If there was drug resistance, the fever would not have subsided. Yes or no? Sai Bharadwaj and Tintin, are you understanding this? If there was drug resistance, there wouldn't have been subsiding of fever. Fever subsided. The drug was effective, but not successful. Why? Because the drug does not have the ability of entering into the liver and to treat the organisms present inside the hepatocytes. Though you can call them as hypnozoids, you're not able to do it. So there is a particular session I have done on parasitology where I have discussed about relapses and recrudescences. You can go back and search in the special classes, not for the plus classes. I'm not trying to make you buy anything for this sake. Go back and see the free classes. In the free classes, I did a particular lifespan class for, there is life cycle classes for microbiology parasites. Check it. Next question. A child presents with sensation of itching, burning, and a probable foreign body beneath the eyelids. Examination reveals photophobia, large oval follicles within the conjunctiva and pre-auricular adenopathy. The most likely diagnosis is what? Use the comment box section again, not the poll. Itching, burning, probable foreign body, photophobia, large oval follicles, conjunctiva, pre-auricular adenopathy. What do you think is the answer? It is not TB. See, if it was TB, you're looking for nodules on the iris. Yes or no? Varshini Granger. See, you are looking for the nodules on the iris. Yes or no? To cause hydrocyclone. That is what is your logic, right? In case of sarcoidosis, mutton fat, ferritis, all these things you're looking for. This is not that. This is just pure conjunctivitis. Please understand, no ciliary body involvement, no uveitis. All of them are conjunctivitis only. On that basis, tell me what can be the right answer. Excellent. It can be allergic or it can be vernal. Please understand, it can be seasonal most commonly. That is why you have pre-auricular conjunctivitis. Sorry, pre-auricular adenopathy. Let's go to the next question. Louis Pasteur is not associated with what? Now we'll do very fast questions. Is that okay? Shall we go faster, people? Shall we go faster? Just say yes or no faster. Okay. Because all these are standard exam repeats. Excellent, Charan Agarwal. So just yesterday, I discussed this. I wanted to see how many of you are able to retain the information that I said yesterday. Remember, yes, Anmoldas, that is correct. Car vaccine was done by Louis. Yes, correct. Now look at this. You are having discovery of M. tuberculosis attributed to Robert Koch. Robert Koch is the father of modern bacteriology, and he was the one who discovered tuberculosis. Rabies vaccine, your anthrax vaccine are both done by Louis Pasteur. What is C? Anybody in the car? I have told you this before, right? Some 3 weeks back, I told you car for Pasteur. Yes, cholera. Very good. Cholera vaccine, anthrax vaccine, and rabies vaccines were done by Louis Pasteur. Spontaneous generation is also done by Louis Pasteur. Next question. Which of the following is the most prevalent constituent of sulfur granules of actinomycosis? I want to see how many of you can get it right. This is May 2004 question. So only 36% people have chosen the right answer. Okay, let me give you a gist. Mycetoma can be divided into actinomycetoma and eumycetoma. The difference is that U means truly caused by a fungi. That does not mean the mycetoma is true. Both mycestomas are true, but eumycetoma means truly caused by a true fungus. Actinomycetoma is caused by a bacteria. The difference is here in both the conditions you'll have subcutaneous, painless swelling with discharging sinuses. These are the most important keywords: subcutaneous swelling, painless swelling, discharging sinuses. If you try to look for the discharging sinus, if it is sulfur granules in nature, think of actinomycosis. If it is black necrotic in nature, think of eumycetoma. Be it eumycetoma or actinomycetoma, the content is 90% made up of organisms, and the sulfur granules are a misnomer. There is no sulfur at all. There is no sulfur at all. And why is it called as sulfur granules? Because the neutrophils and the particles of the bone can look yellow in color, because of which it is giving a feeling of sulfur granules. But the most important concept is organism. The same is the concept in case of eumycetoma also. In eumycetoma, you'll be having fungal mycelia. Please understand, in eumycetoma, the black necrotic discharge contains fungal mycelia. In actinomycetoma, it contains bacteria called as Actinomycetes, Nocardia, Actinomycetoma madre, Staphylococcus aureus, and Alascheria boydii. Next question. A characteristic infection of Nocardia asteroides is which one? Among them, which one can be attributed to Nocardia asteroides infection? Okay, that's a decent game. We have 59% people giving us the right answer. That's a well played game, people. Nice, really nice. Welcome, Khushbu Kumari. See, remember, nocardia has nothing to do with diarrhea. Can you tell me why? Nocardia has nothing to do with diarrhea. Why? Why not? Anybody? I'll tell you the concepts here. Listen very carefully. Actinomycetes has something to do with diarrhea because actinomycetes is anaerobic. Nocardia is aerobic. In your body, respiratory system is aerobic, being extremely favorable for nocardia to survive and create problems. But GIT is the exact opposite. GIT is an anaerobic system. In the anaerobic system, actinomycetes is the commensal. In the lung, the nocardia is the commensal. And this can actually not cause. How seen is that? CNS infection can happen only by blood-borne dissemination. It can happen for both nocardia and actinomycetes. But tell me, who is very far away from the brain? GIT or the lung? Simply speaking, in practical purposes, who is far away from the lung? I mean, from the, yes, GIT. So brain abscess is most commonly caused by nocardia and rarely caused by actinomycetes. Let's go for the next question. Nocardia is stained by all except. Let me tell you this, people. Whoever is staying here and has been trying to answer as many questions as possible, it shows your commitment to learning. It is 10:50 in the night. There is no necessity for you to sit in this area and listen. Likewise, as a teacher, there is no necessity for a teacher to take free classes, but I do it. Why? Because every time I put in a hard work, I understand somewhere in the universe your efforts will be recognized. Likewise, whatever efforts you're going to put right now, they will make a difference for you. You will become a better person for every single effort you're putting. So never ever question your efforts. Please understand. Remember this statement. Keep doing every day whatever you're supposed to do. Keep doing every day whatever you're supposed to do because you can do it easily. If you keep on doing easy things every day, slowly you get the strength to do difficult things. And every time you finish the difficult tasks, then God or the force of universe will do the impossible for you. So for that reason, you're working. So never feel completely drained out. At this point of time, if you're feeling completely drained out, do not feel bad. You are not alone. There are 1,35,000 students who are taking NEET exam, and not everybody gets a seat. Only 17,000 maximum number of seats are available. So what happens to the remaining 1,20,000 people? It means they all will be suffering. You are not alone, but you do not want to be alone in this group. You want to be in this group, right? For that, you're working hard. So please remember, every single hard work you perform will take you one step closer. It is always better to go towards success than to stay in the same place and die a very terrible death. Yes or no? So please understand, if you cannot fly, just run. If you cannot run, walk fast. If you can't walk fast, walk slow. If you can't even walk slow, please crawl. But please keep moving. Never stop. This is the only suggestion I can give you. I'm not somebody who is going to advise you on anything. This is just the suggestion I can give you as a person who is elder to you, who has seen these exams 10 years before you. So I hope all of you will be successful. And when you're successful, will you come back and tell me again? When you come back and will you come back and tell me that you succeeded? Yes or no? Yes, thank you very much. So nocardia is stained by all except Kiram stain. Take this as a homework. Find out what is Kiram stain and tell us what exactly is stained by Kiram stain. Also remember, mucin and Alcian blue both can stain mucoid material. Alcian blue and mucin both can stain mucoid material of nocardia. And acid fast stain is giving you partial acid fast answer. Partial acid fast answer. The organism will be looking like a beaded filamentous bacteria. The organism looks like a beaded filamentous bacteria. What is the extra information? You will be using 1% sulfuric acid or 1% acetic acid for acid fast staining. Okay, let's go for the next question. A 3-week-old child presented to pediatrician with meningitis. Presumptive diagnosis of late onset of a perinatal infection was made. The CSF culture was positive for gram-positive bacilli. Which of the following characteristics of this bacteria would be helpful in differentiating it from the other bacterial agents? We'll see how many of you will get this right. Okay, so only 38% people have got it right. Come on, people, you can do this. Okay, it has fallen to 33%. It's okay. If you can't answer in a classroom, please be happy. Why? Because when you come to a classroom, it is not here to show off what we already know. We are here to learn what we do not know. Yes or no? When you get your answers right, it is nice. It gives you a good feeling of confidence. But when you get it wrong, please do not get depressed. Please learn to be happy. More you learn, the more you're going to fight the exam better. That is the only logic. Yes, correct, Radhika Chandra, Saram Agarwal. The diagnosis, listeriosis. Now, can you tell me at which point of time can you make a diagnosis of listeria? Which part of the question told you it was listeria? Yes, when you speak about perinatal, you can speak about neonatal meningitis also. Excellent, understood. But is that the only point? Please understand, CSF culture was positive for gram-positive bacilli. Can you show any other meningitis showing gram-positive bacilli? You can say MTB is gram-positive, but in MTB to be demonstrated in CSF, you go for AFB. So when you speak about bacterial meningitis, you don't take atypical bacteria into equation. Please remember this. All those people who are going for the entrance exams, remember, atypical bacterial meningitis is not called as bacterial meningitis. Atypical bacterial meningitis is called as aseptic meningitis. So bacterial meningitis is a word reserved only for pyogenic bacteria causing meningitis. This one is a pyogenic bacteria. For example, MTB, M. leprae, chlamydia, rickettsia. If these organisms cause meningitis, it is still aseptic meningitis. But the most common cause of aseptic meningitis would be viruses. Here, it is listeria, it is a gram-positive bacilli, and this organism can be motile at 25 degrees Celsius. Can you tell me? Yes, Tintin. This is Streptococcus agalactiae, which is a gram-positive cocci. It's a gram-positive cocci in chains. It is not bacilli. Yes or no? Now tell me, motility at 25 degrees Celsius is because of what motility? What is the name of the motility, people? It is called as slow tumbling motility. Excellent. Slow tumbling motility. Excellent. Let's go for the next question. Pastorella maltosida is transferred by Nirja Merugu. Nirja Merugu, have you come to this class for the first time? Have you come to my class for the first time? Nirja Merugu. Okay. Are you a post intern or an MBA student? Okay. The right answer would be, okay, look at this. Hariprasad is on top. Tintin, Rajchandu, HD, Raj, Sai Bradwaj, Varshini, Chandrasekhar, Radhika Chandra, Popcorn. You're doing an amazing job. Others, please come back and catch them up. Right answer is animal. See, Pastorella maltosida is the most common commensal present in the oral cavity of dogs. And the second most common commensal present in the oral cavity of cats. Who is the first most common commensal of the oral cavity of cats? It starts with C, that is Capnocytophaga canimorsus. I repeat, Capnocytophaga canimorsus is the most common organism found as a commensal in the cats. The second most common organism found as a commensal in the cats would be Pastorella maltosida. So Pastorella maltosida is very common between all the pet animals. So from the pet animal bites and scratches, you can get the infection. Apart from them, you can get the organism from aerosols also. So in this question, B is a better answer than that of A. So if you had chosen B, you'll get full marks. Okay, next question. The fungi which do not have sexual phase belong to which of the following groups? The fungi which do not have sexual phase belong to which of the following groups? Okay, I can sense 55% people getting the right answer. What about the remaining people? Why are you not able to get the right answer? Because you don't remember the classification. Don't worry about it. The classification is very important. Let me tell you the classification in short. Shall I tell you the classification in short? Only if you like it. Are you in the mood to listen? Okay, look at this. We divide fungi into higher fungi and lower fungi. This is based on septation. If there are septations in the fungi, you call them as higher. If there are no septations, you call them as lower fungi. Now, among the higher fungi, we divide them into sexual, asexual, sexual, asexual, spore forming ability. Now, in case of higher fungi, the sexual spore forming organisms are divided into Ascomycetes, Basidiomycetes, and Deuteromycetes. All these are higher fungi with sexual spore producing ability. Now, Ascomycetes produces ascospores, Basidiomycetes produces basidiospores, and Deuteromycetes will be called as Deuteromycetes because they don't produce any spores. No spores are formed. They are meant to form sexual spores, but they don't form sexual spores. So they are referred to as imperfect fungi or fungi imperfecti. In the whole web of your classification flowchart, remember, fungi will be divided into higher and lower. In the higher, we have sexual and asexual spore forming organism. Under sexual, we have asco, basidio, and deutero. In that, deutero is the one who is actually fungi imperfecti, not being able to produce any kind of sexual spores. Next question. Selenium sulfide is indicated for treating what? Think before you answer. Selenium sulfide is indicated for treating what? It's a very old question. COMED K 2008. There was a consortium of medical colleges in Karnataka, which was Private Medical Colleges Association. The questions were moderately tough, moderately easy, not too easy. They were between moderate to easy. That questions carried very valid statements. Those questions were actually picked up from the All India exams also. So they were actually reflected in the All India also. So when you actually get your understanding of these questions, you'll be good. Tinea versicolor can actually attack different parts of your body. Why is it called as versicolor? Because of the versatility of discoloration. Versatility means what? The ability of it to cause multiple shades of discoloration. Yes, it can cause both hypo and hyperpigmentation. In that area, sulfur present in the selenium sulfide is capable of disrupting the disulfide linkages present in the enzyme. Now, how many of you know the enzymes that are causing tinea versicolor? Come on, people, come on, come on, come on. I have told you this in one of the plus classes and also in the special classes. I have told you this in one of the special classes and plus classes also. Name the enzyme, name the compound produced by these organisms which are capable of causing versicolor. Excellent, very good, superb, Tintin and Rajraj. Excellent, it is azelaic acid. Azelaic acid is the reason for attacking this area. That can be controlled by disulfide linkages. Let's go for the next question. Okay, what is the topical treatment? I'll zoom into it for you. Look at this. Topical treatment is selenium sulfide, salicylic acid, and sulfur. If you want to use orally, go for ketoconazole. Transfer factor used for immunization is it immunoglobulin, vaccine, toxoid, or lymphocytes? Wow, nice, Varshini. What is the answer here? Transfer factor used for immunization. Remember, whenever we speak about immunization and we use the word transfer factor, which part of immune system is involved? Is it CMI or HMI, people? Saransh, you fell for this part. HMI is humoral immunity. That indicates only antibodies. But antibodies are never used the word transfer factor. Transfer factor is a word used for passive transfer of CMI. I repeat once again. For example, when we speak about anti-tetanus serum, or hyperimmunoglobulin serum, what is that? Passive transfer of what? What is it? It's a passive transfer of what? Come on, people. Saransh. When I give anti-tetanus serum or hyperimmunoglobulin, I'm giving antibodies. But when I use the word transfer factor, I'm trying to transfer CMI. That indicates the lymphocytes called as leukocytes, especially T lymphocytes, especially T8 lymphocytes, along with cytokines. T8 lymphocytes and cytokines together is the reason for getting transfer factor. Let's do one more question. Which of the following statements is correct regarding chronic granulomatous disease? Autosomal dominant, characterized by abnormal bacterial phagocytosis. Recurrent streptococcal infections are usual in this disease. Nitroblue tetrazolium test is useful for confirmation. What is your answer? Which is the correct statement? Did you enjoy answering these questions? See, more than the questions, it needs somebody to goad you. You need somebody to goad you, that is guiding you through the pathway. I tried my best. I have taken almost some 26 free classes in this month just to make sure I can reach out to many people like you so that you can be enjoying it. See, learning is a very long process. Why not be? Excellent. Nitroblue tetrazolium test is useful for screening of chronic granulomatous disease, not for confirmation. If you want to go for confirmation, you have to go for gene studies. Is that okay? Hari Prasad? Okay, so you all are going to study very well. Until I meet you in 10 days from now, I want you to be successful. I want your preparations to be perfect. I want you to be very hard. Do not give up on any point of time. And I'll be praying for you. I'm telling you, I'll be praying for you. When I come back in 10 days, we'll again restart the sessions. And all the sessions, we'll make sure that tough questions will be posed for you. You will be like joint tough questions, right? Before the day of exams, you'll be having questions so that 1 week before the exams, we'll have certain questions and make you become stronger. And if you like these classes, please put a thumbs up and please dedicate your hats, not just for me or any other faculty you like. Whatever hats you have on the left-hand top corner of your profile, dedicate to the faculties. The more you dedicate, the more XP points you get. The more XP points you have, you can get it as a discount against it. Okay. Yes. So if you have any other, okay, let me tell you this. From tomorrow till November 30th, I'll run unacademic based MCQ quizzes. Okay. Unacademic quizzes I'll be running. That is, I'll mark quiz contests. That is 5 questions, 10 questions, or 15 questions sparks will be coming out to you. So every 5 minutes, you will be able to finish 1 quiz. Like that, we'll be having 4 to 5 quizzes in a day. And I'll be posting about the links of the quizzes and the code to join the quiz here. All Android users, don't miss this class. Come and join Telegram for your thing. No, Niraja, I'm telling you, in a day, on 4 different timings. Let's, for example, morning 10 o'clock, afternoon 1 o'clock, evening 5 o'clock, night 10 o'clock. I'll just post it 1 hour before. Okay. On the Telegram group, I'll post 1 hour before. Just come prepared, or you don't come prepared also. Just attend the tests. Every test session, you'll be having some 5 to 10 questions. At the end of the day, in regular intervals, you'll be doing 40 MCQs. Are you following this part? Is it not a good deal? See, every day, you'll face 40 MCQs. You'll try to know the answer. So that every day for the next 5 days, you'll be doing 200 MCQs. It means out of 200 MCQs, even if you get 1 MCQ in your exams correct, you'll be jump starting your rankings. Yes or no? So this is what I ultimately aim. In any way, if I could help you reach your successful story, I'll be very happy. So thank you so much for staying till there. Have a good night. I'll see you again in 1 month. Bye-bye. Love you. Nirja, I'm saying we'll take a call depending upon how many people are willing to come. So when I post it, I'll ask for the timing. For example, tomorrow evening we'll start. Evening around 7 o'clock if we have a test, or 10 o'clock we have a test, we'll start. I'll ask how many people will join so that you will be able to come. Okay. Just tomorrow we'll just trial it. After that, we'll fix the time. I'll follow your suggestion, Nirja. Okay. Thank you. Good night. You want to see the leaderboard? Okay. Now just click on true. Just click on true, all of you, to see the leaderboard. Thank you, Scorpion, for your amazing words. Thank you, Hari Prasad, Lasha, Nirja, Scorpion, Chandrasekhar. Thank you, Bhargavi. Okay, let me show you the leaderboard. Hari Prasad on top, Raj, Raji Chandu, Tintin, HD, Chandrasekhar, Sai Bardwaj, Yadkar Chandra, Priyanka, Popcorn. Thank you so much, all of you. Congratulations to the winner. Others, come on, get motivated. You can do it. Okay. Bye-bye. Good night. See you soon.